Why strengthen the neck? Strengthening exercises are increasingly recognized as essential for patients with neck pain and related disorders. Research shows that muscle dysfunction in the cervical region contributes to chronic pain and impaired motor function. Therefore, targeted strengthening of the deep cervical muscles and shoulder girdle plays a crucial role in restoring muscle balance and improving cervical function. Cervical strengthening is not limited to surface muscles. The deep cervical muscles, responsible for spine and stability, are often dysfunctional in chronic neck pain. Physiotherapy programs aim to restore muscle balance and optimize cervical function through progressive strengthening and stabilization exercises. Evidence supports that combined programs targeting the neck and shoulder girdle are effective in reducing symptoms in conditions such as cervical neuralgia and cervical headache. These programs also often include neurodynamic exercises. But who benefits from neck strengthening? Firstly, patients with neck pain. Muscle rehabilitation reduces pain, restores function, and prevents relapses. Also, patients with cervicobrachial neuralgia, because strengthening combined with neurodynamic techniques reduces nerve irritation. Patients with tension-type headaches and migraines can also benefit from that. A 12-week neck strengthening program can reduce headache frequency and intensity. Patients with temporomandibular disorders could also be a group that benefits. Although the mechanisms are not fully understood, cervical strengthening may support TMD management. And let's talk about whiplash and cervical headache. Muscle re-education is critical for post-traumatic recovery and symptom relief. But how to strengthen the neck is another thing. Shoulder girdle strengthening could be essential. It stabilizes the scapula and reduces cervical load. Cervical strengthening is also very important because it reduces muscle function and reduces nerve root pressure. Deep cervical muscle activation is essential because it enhances cervical stability. Individualized program exercises must be tailored to the patient's diagnosis and needs. For example, cervicobrachial neuralgia could be combined neurodynamic and strengthening exercises. Tension-type headache could be progressive strengthening that reduces muscle hypersensitivity. Dosage and progression programs should follow the FIT principle, which stands for frequency, intensity, type, and time, and can be adjusted to patient tolerance for safe and effective progression. In conclusion, cervical strengthening benefits patients with neck pain and headaches, cervicobrachial neuralgia, and TMD. Correctly identifying functional deficits and tailoring exercise programs can significantly enhance quality of life. Combining strengthening with controlled aerobic exercise is particularly beneficial for non-specific pain.